Hello, everyone, and welcome to another special edition of Wellbeing Wednesdays, where we have two doctors talking with each other. My name is Dr. Giles P. Croft. I am a former NHS surgeon, and I'm here with Dr. Brian McElroy, who is an NHS GP. Hello, Brian. How are you doing?
Hi, Giles. I'm doing great, thank you.
And we're talking about well-being and health. And today, well, what are we talking about today, Brian?
So, Giles, I was interested in exploring how this understanding could be so helpful for healthcare professionals, GPs, but all healthcare professionals, and how it's maybe different from technique-based resilience programs, and how it's, I guess, different from a lot of other things out there, essentially. Um, so that's kind of what I'm interested in, as well as kind of explaining what the understanding is. So what it is we're actually talking about. So giving a little bit of meat to what we're talking about and having people reflect on something quite useful for themselves. Yeah.
So what popped up for me immediately, which people might be thinking, is when they heard the R word, which is resilience. And resilience gets a little bit of a bad rap these days, doesn't it, in medical circles? Because, and understandably so, because it I've seen a lot of times where difficult work situations have been sort of the responsibility for poor working conditions has been put onto the individual, and they've just been told, oh, you're not resilient enough, we want to send you off on resilience training or something like that. So maybe a good way into this might be to have a little bit of a discussion about what you and I see as resilience.
Yeah, sure. That sounds great. That sounds great. Yeah, and that's a really interesting. What you just said is so interesting, really, isn't it? Like, because there is, I think we both know, there are a lot of working conditions within the NHS, within healthcare systems worldwide, which certainly are not ideal, and which have people doing an excessive amount of tasks for any human being, no matter how quote unquote resilient they are. Um, and in a sense, I think the systems that people find themselves in are perhaps lacking some common sense in terms of management and leadership. And that's another thing that comes out of this understanding, I think, is that we develop a sense of common sense, and we're able to see the wood from the trees and what actually needs to change and what doesn't. But to go back to your question about resilience, yeah, so resilience, I think, for me, is about being able to live more and more in the here and now, recognizing that the here and now is the only place to live,
Yeah.
and recognizing that anything that takes us away from a sense of ease in the here and now is coming from something internal. So it's coming from a stressful thought that we're taking seriously. And yeah, and I guess that's I'll leave it there. That's a short definition of resilience to me. What about you?
Yeah, well, I mean, I think if you look it up, there's a kind of it's a sort of like a bounce back ability, isn't it? It's kind of like bending and then going back into the same into your original shape. And I mean, I see resilience as innate, as something that it is literally just part of us as human beings. I mean, I've got one of my favorite props here, which is my snow globe. And, we get shook up about things, we get a whole load of thinking about things, and then we settle. And really that's life is, one moment after another, one mood after another, one felt experience of life after another. And resilience is built into that model. So you only have to look at small kids to see how quickly they come back into balance when they're not. We're like those weebles, aren't we? Anyone who's old enough, weebles wobble but they won't fall down. That's a little bit like us. And no matter how bad circumstances, and I'm not detracting from terrible working conditions here, but there's oh, I've got another prop somewhere in a box, but I have the word "and" printed on a bit of paper, because whatever's going on for us, we're there in those circumstances, we're there in those difficult working conditions, and our experience of that is happening inside of us, and it's happening by thought, it's happening through thought. So and that's what we're feeling, you know, when we have these feelings of tension, when we have these feelings of stress, it's our thinking about the situation. Now, again, what I really want to say, that I'm not saying that conditions shouldn't change, but I think you touched on it, didn't you, when you said that that there's a there are ways of implementing organizational change, and we can either implement organizational change from a place of insecurity and misunderstanding about how our minds work and how life works, or we can implement change from a place of calm and a place of presence and a place of seeing what's going on. And I mean, I know whenever I'm in a difficult situation, like, losing my head's never, ever, it's never helpful at all. It's never helpful at all. And seeing that all that there is the present, and letting go of all the stories about, you know, how things should be, and what someone's done in the past and what might happen in the future. All of that's a story that's going on in our head, when the reality is we've got a situation right under our nose that we can respond to from a place of calm and presence.
Yeah, lovely. So you've kind of described a lot of the nuts and bolts of how this understanding can bring about resilience. So I guess I'm wondering, and this is just a question, kind of being devil's advocate. So I go to work this afternoon, and my snow globe gets shook up.
Yeah.
So what do I do in that situation? I'm a GP, and this is going to happen to any GP who goes to work at some point during the week, probably. So I'm just going to put it back to you. What do you suggest, and I can respond in my own way in a moment.
Yeah. Well, the temptation, what we've been taught, is that there is always something to do. That if we have feelings that we don't like, that we must do something about that. And I think this is where we get into that sort of that slightly murky area of, oh, you need to meditate more, or, oh, you need to and we don't need to do anything, because that's built in. I mean, that is resilience. It's actually built into the system. And if your snow globes, if I want to see clearly once more, then thinking, oh, I shouldn't be feeling like this, that's shaking it a little bit harder. And, you know, every bit of thought that we layer on top of the situation is just shaking up our snow globe even more. And from the work that I do with clients, I've seen that the less we do, and the more we see that there's nothing to do, the more that we understand the nuts and bolts of how it works, the more that we can kind of relax into that, oh, you know, I don't need to do anything right now. All I need to do is recognize that I'm shook up. There's a wonderful, wonderful metaphor about being in a low mood that says, being in a low mood is like driving through fog, because fog, you never know when it's going to end, but you know that it will end, because it's not the natural state of weather. And you know that the sun's always there. It's like the sun's not, it's just behind the fog somewhere. So what do you do when you're in fog? You don't step on the accelerator. You don't try and do a whole load of stuff to try and get rid of the fog, because it just doesn't work like that. No, you slow down. You recognize that you're in fog. You proceed with caution. So if you're in a low mood, if you're all shook up, you know, it's a good idea not to send an email to the practice manager, because you probably regret that email when you come out of your low mood. So you proceed with caution, and you use what light you have you do the absolute best that you can, but you understand that you are driving through fog and you proceed with caution. So that's the advice I'd have anyway. What about you?
Nice, yeah. One of the things that just came to mind as you were speaking was, I guess, what we're speaking of in terms of helping with resilience is really an understanding of how human beings work. And we kind of use it as an understanding of how all of us work. So there's a similarity about how all of us work, whether we're a doctor, whether we're a patient, whether we're a practice manager. And I was just thinking of a practical example that occurred a couple of years ago where, in my view, I'd done a really good job of picking up a patient who had hyperthyroidism. She came in, she had a urinary tract infection, and I happened to check her pulse, which was quite high. I'd done her bloods, she was hypothyroid, and then we started her on medication. But I don't know if you're familiar with hypothyroidism, but it can take a couple of months for like very challenging symptoms, particularly like physical symptoms of anxiety, to settle down. And about 6 weeks in, I got a letter in complaining about me, that I wasn't doing a good enough job. Basically, she was still in a really bad state. And like, I had done all the kind of things that one does as a GP. I'd contacted endocrinology for advice, and prescribed appropriate medications. And I remember receiving this letter in that moment and reading through it and recognizing that I had done nothing wrong, and recognizing that, well, first of all, I guess reflecting, had I done anything wrong? And then when I could see that I hadn't, and discussed with colleagues, then it was like, well, she had done nothing wrong either. You know, she was in her own place. She was acting out of a place of quite intense anxiety at the time, and she was doing her best to manage with that. And when we're anxious, when we're angry, that's what we tend to do, isn't it? We tend to blame people, situations, and the greater the intensity, the more likely we are to kind of lash out, so to speak. And I remember reading that and kind of wondering, okay, so what do I do? You know, and I can't remember exactly what I'd done, whether I gave her a phone call or what did I do, but my kind of internal sense was, okay, there's nothing to do here. You know, there's nothing wrong. I kind of knew that it would settle down for her, and I knew not to take this personally. And also, and this might sound a bit odd, but I kind of realized that there's nothing that I can do to avoid criticism. And not that there's nothing I can do, like there's lots of things I can do, but criticism can happen no matter what I do, put it that way. So I could be the most perfect GP in the world, whatever that means. As in, I could do all the right things practically, but people in low moods will still find a way to critique. And realizing that is quite freeing, because I don't have to have huge anxiety about not being critiqued. About not being critiqued. So kind of having this understanding of how everyone works, because I have so many interactions in a day, like I might have 40 interactions over the phone or face to face in a particular day, having this kind of grounding as to, okay, so I work in the same way internally as anybody else. I can have low moods in the same way other people can have low moods. And if I take those low moods seriously and get lost or caught up in them, then I'm going to act out. Like anyone in my circle of contact could come in contact with the effects of my low mood, essentially. If I'm taking it seriously, if I'm getting lost in it. So in the same way, I guess I can very much relate to what you mentioned in like feeling stressed or feeling down on a particular day, but also knowing in the back of my mind that, okay, well, this is finite, this is going to settle down. This isn't who I am, this low mood, or this stressful feeling, and then kind of bouncing back, or kind of like coming back into that place of presence, without any drama, without any need to do anything, I guess, which is really freeing. You know, it's really freeing, because I would have been someone who would have practiced a lot of techniques, I guess, prior to coming into this understanding, and it frees up a lot of mind energy when you know that you don't need to put any mind energy into well-being, that it is there as your kind of natural go-to place.
Yeah, that's beautiful. And I've so many things we could talk about from in there. That the I mean the strap line of Wellbeing Wednesdays that I've just recorded a little meditation on is that there's, to experience well-being, there's nothing to do, only something to see. And just like you can just follow the logic of like the neuroscience through for that, like we can only ever experience the present moment. Like there is literally nothing else but the present moment, like one after another. And so in that present moment, the present moment must contain everything. So our happiness and our well-being and our health exist in the present moment and nowhere else. And any time we think that there's something to do, that is taking us away. That is saying, I'll be happy when, I'll experience my well-being when, I'm going to create this story that I require a certain set of circumstances to feel a particular way. But it just, I mean, there's no way it can, how can a workplace like transmit feelings to inside of us? How does when, even if somebody was stood there yelling at us, then what's actually going on, and we as doctors all know this, what's actually going on is that we've got we've got light waves, and we've got sound waves, and we've got whatever physical sensation at the time, and all of that is all that data, being plugged into a USB or something. All that data is going in, and then our little version of reality is being created from all of that data. And so it goes through the filter of our thinking. And I think for me, if we're talking about the nuts and bolts, what's truly liberating for people is to see that 100% of that experience is happening indirectly. 100% of that experience is happening in thought. There is no other way to experience anything but in thought, which is why we've all got different opinions, and we've all, you can go to the cinema and you can be sat right next to somebody and have the exact same experience, technically, in terms of the data that's coming in, and yet both have a totally different interpretation of a film and a totally different experience of a film. And that just goes to show that it's all going on inside of us. And that's liberating. And like you say, to see, when we see that in ourselves, when we really see it, not like kind of like intellectually, oh yeah, okay, so I'm feeling my thinking, but no, when we have insights around that, when it really gets in our bones, when we really see that we're living in a world of thought, that we're living in this little virtual reality bubble that we're all walking around in, well, then we see everybody else is experiencing exactly the same thing. Your colleagues are, your patients are, your practice manager is. We're all wandering around in our own little separate realities, and we're all wandering around in the misunderstanding that our feelings are coming from the things that are happening to us, when they're not. Our feelings are coming from our perception of those things, and that's why it's hugely liberating for me.
Yeah, I love how you explain that. It's really quite something, and like it just shows, like what comes to mind for me is how we are meaning making creatures. Like like the person shouting at us, we can interpret that in so many different ways. We can think, oh, there's something, I must have done something wrong, or this is a terrible situation. Or we can be like, okay, someone's shouting at us, and the best thing to do now is X, Y, and Z. And but there's just we do it moment to moment so often. We make meaning all the time, and there's nothing wrong with it, and it makes us human, and it's absolutely amazing. But also, I think what I think is quite helpful for me as a GP in listening to people is recognizing the meaning they're making from their life experiences, their symptoms, because I guess the guy who came up with all of this, a guy called Sidney Banks, described thought as the missing link.
Mm.
And I think what you're describing is how we're kind of aware of the missing link moment to moment. And when you're aware of the missing link moment to moment, you can't get too caught up in that snow globe, because it just over time it happens less and less. That's been my experience, at least.
Yeah.
Yeah.
Just bit we're getting close to 30 minutes here, but before we wrap it up, I just want to go back to a couple of things where you said about when you'd been shook up in the past, and you were aware of techniques that you could use to help with your feelings. I think there's a subtle difference here in understanding what those techniques might do. So for instance, if I'm in a difficult situation and I become aware that my heart's racing and I'm I'm getting quite tense and I'm getting quite anxious. Now it's common sense to slow down and take a good few deep breaths. And I think the key is to see, okay, you've got the physiology there, that if you take deep breaths, then it's going to activate your parasympathetic nervous system and it's going to bring your heart rate down and everything. But when you see that the feelings of anxiety and the feelings of stress are a 100% reflection of anxious thinking and stressful thinking, then we just get a different view on those techniques. So I don't see there's anything wrong with techniques. If I'm in a low mood, or I've had an argument with my wife or something, or a difficult conversation, then I'm going to get shook up. Now, and then it might occur to me. Oh, I want to go out for a walk. Or it might occur to me that, I might listen to music for a bit. Or it might occur to me to really throw myself 100% into a meal. And the difficulty comes, this is where people get easily tripped up, is when we don't know what those things are doing. All those things are doing is almost like acting as a placeholder for that to happen, for nothing to happen, for us to settle naturally, for our thinking to settle naturally, because it will. As soon as we put our well-being on the thing that we're doing, as soon as we get into situations like, I'm feeling shook up, therefore I must go out for a walk, because going out for a walk is what settles me down. No, it isn't. Your thinking settling on its own is what settles you down. Oh, I must go. I'm going to have to go and meditate. No, because meditation calms me down. No, it doesn't. It's not the meditation that's calming you down. It's your thinking settling of its own accord. So I don't see any problem with techniques so long as we understand what those techniques are doing. And they're not really doing anything. It's us, it's like it's calming down our insecure thinking, but they're not necessary. They're not necessary at all. We'll do what makes sense in any given moment when we're shook up, when we see what the feelings are telling us. This is another kind of like important thing. When we see that the feelings aren't telling us about the content of our thinking, when we see that the feelings aren't giving us any feedback on what it is we're worrying about, what it is we're anxious about, the feelings are telling us, hey, buddy, you've got some anxious thinking going on here. Our feelings are telling us that we're thinking, not what we're thinking about. And that combination of those two things just it just allows us to go through life with a bit more ease, and a bit more of a sense of humor. And it's like, oh, there I go again, off in my stories, off in, creating a whole load of judgments and analysis and putting this in that box, and this should be like that, and this is good and this is bad. And when we see that we're doing that, well, we can just let go of that a little bit. And again, we can relax into the present moment of what actually is. And that's when our intuition comes to the fore. That's when our wisdom comes to the fore. That's when our common sense surfaces. We need all that sort of blibber blabber chatter out of the way to be able to hear our own common sense and wisdom, don't we?
Yeah, that's a fantastic choice. The other thing that comes to mind is, with the technique, it always implies that where you are here and now is kind of somehow not good enough. Therefore, you need to do X, and then you'll be in a different here and now. But it's kind of subtle, but actually, if you're already in the here and now, always, then, that's where we want to be. That's where we're naturally. That's where our well-being naturally rests.
That's what we're built
Then anything that we do, any story that we create that says, "Oh, I can rely on this thing to bring me to another place, and then things will be better," then somehow we can kind of miss out on the here and now, in a sense, and we can kind of I don't know if you sense what I'm speaking about, but there's kind of there's a subtlety when I know that when I've become reliant on techniques in the past, that I've kind of made an assumption that the here and now isn't good enough. In lots of situations, that I need to be on my meditation chair, I need to be out walking in nature, I need to be having a nice coffee with a friend, etc., etc. The list goes on.
And you can hear it there, can't you? I mean, that's the thing, that's the thing to see, is to hear that voice saying, I need.
Yes.
Because
Yeah.
you really don't.
It's one of the last, possibly, maybe it will never leave me, but I need to get out of work now, by 6:30 or by 7 or whatever. And I've been noticing recently, when I feel that, I hear the voice and I feel it in me, there's kind of like an excitement, an anxious excitement to get out of work. And I can like a couple of times recently, I've just realized, whoa, I'm missing this, I'm missing washing my hands. I'm missing, where do I want to be anywhere else other than where I am now? And that might sound strange because, there's such a heavy condition that it's good to get out and work on time. It's good to get home to be with your loved ones for dinner. And that's natural in one sense. But at the same time, if it's something that's going on and on and on, then it's an unhelpful habit pattern, I guess, that I can recognize, and I'm sure a lot of other people can recognize that as well.
And again, just to just to make it perfectly clear, we're not saying that you should just put up with having to stay at work late all the time. That is totally not what we're saying here. What we're saying is seeing how we're experiencing reality really, really helps, because like I say, that's when our wisdom comes to the fore. That's when our common sense comes to the fore. That's when we have the realization, hang on a minute, I need to have a word with somebody about this. This and that's something that we may have put off doing for a long time, because we know that there's going to be a difficult conversation coming. And so we take it on ourselves and we live in our story instead of living in reality, instead of seeing what's going on. And it might be that we get a bit more relaxed about staying a bit late from time to time, and we don't have as much of a story going on about it. But equally, it might be that once we've let go of the story, it might be a different story that's playing. We're all living in separate realities. Who the hell knows what's going on in your mind? So it's always about the more we live in we're built for reality, and reality is the present moment. It's no more complicated than that. Anytime we're not in the present moment, anytime we've got that I need, and this has to be different, and that is not living in reality. That's living in a story in our heads. And the more we can live in reality, in the present moment, well, we just do better. We just do better. We have good ideas. We feel relaxed, because we're not making ourselves all shook up with our thinking. And we have good ideas. We know the right thing to do in any given moment. I think that's the key, isn't it? Is that in any moment we have what it takes. We have what we need if we will listen for it.
We feel more alive. We feel more, you mentioned young children. We feel more childlike.
Yeah.
The inclination to have a little bit more fun around things is always there when we're more present. When we're present, not more present, just when we're present.
Yeah. Well, when we see there's nothing else. I mean, that's
Yeah.
the thing, isn't it? People are always asking, well, how do I be more present? Well, that's looking at it from the wrong angle. It's like, well, why am I not more, why am I not in reality? Why am I not more present? And it's because we're caught up in this misunderstanding that we're feeling the world, when in reality we're feeling our own perception. That might be a good place to finish.
Yeah, thanks, Charles.
No, very welcome. And let's do another of these and cover another topic. And so where can people find you, Brian? Because I realise that this might be a bit new for people to hear, but again, it might be that it really resonates with some other things that you've heard of. This is nothing new that we're talking about here. I think there's just been there's a resurgence happening at the moment, isn't there? Kind of like making this understanding of how we work. It's not complicated. In fact, it's the fact that we try and make it complicated that gets in the way. Really, it's very, very simple, and it's something that we've known for a very long time, but it can be a bit unusual. So if anyone wants to ask us any questions, where can they get hold of you, Brian?
So I have a website, brianmcelroygp.com, and at the bottom of my website, there's a Facebook icon, so you can just click that, contact me through Facebook. That's what I've been doing mostly for now. Yeah.
Cool. And for anyone who's seeing this first, this Wellbeing Wednesdays for the first time, there's a Facebook group Wellbeing Wednesdays that I'll put a link in the show notes for this this conversation, and you can find a whole ton of recordings. I've got a YouTube channel that's got a whole load of Wellbeing Wednesdays recording and our conversation that we had last time. So thanks for joining us, Brian. A pleasure as always having a conversation with you, and I very much look forward to the next one. And take care, everybody. Bye bye.